If you've been told you have arthritis in your knees, you might want to listen to this video. My name is Dom and I'm the clinical lead physiotherapist here at Thorpes Physiotherapy. As you can imagine, we see a lot of people coming through with knee pain and arthritis in their knees throughout the clinic. So I wanted to take the time to share my thoughts on arthritic knees to kind of dispel some of the misinformation. So the first thing when people come through and they've been told they have arthritis is often they're quite worried, they're quite concerned, mostly because arthritic knees tends to have that label of being degenerative, which is true. Like as we get older, our bodies change and they adapt, but that doesn't mean there's anything you need to worry about with it. Just because it is a degenerative condition, firstly, this might sound a bit counterintuitive, but that doesn't mean that it's just going to go down and down and down and get worse and worse. There are things we can do to kind of keep the knee nice and healthy. There are things that we can do to kind of alleviate the pain. If that was the case, we wouldn't be seeing as many people through the clinic as we do. We wouldn't have as much success as we've been having as well. So that's the first thing with it. The second thing is that people seem to think that if they have arthritic knees, it's a ticking time bomb until they need a knee replacement. That's also not true. You can have arthritis and live a perfectly fine, happy life, no problem, no pain. But in some cases, if you have very severe arthritis, you do go on to need a knee replacement in some situations with it. But there are things we can do to mitigate the risk of that. There are things we can do to help alleviate the pain or get rid of the pain in some cases. Just because you have arthritis doesn't mean you're doomed to need a knee replacement in the long term as well. The last thing is that because of this degenerative label, people think, well, it's wear and tear, therefore if I stop moving, I'm going to stop wearing it out. That's not true at all. If anything, if you start resting too much and stop using your knee because you don't want to wear the joint out, the muscles get weaker, which actually can speed up the process of things getting irritated and the arthritis getting worse. One thing that we know is that people who are active and do more exercise tend to have better resilience for their knees, and they don't tend to suffer as much even if they have arthritis as well. So keeping active, keeping yourself nice and strong is very much a good idea. If you wanted any guidance about where's a good start, I mean, the World Health Organization have good guidelines on physical activity and what is a good amount for being normal. If you wanted any more details with that, more than happy to see you in the clinic to go through that on a more bespoke, individualized basis. So arthritis, in summary, arthritis is quite a complex condition. It's something that you can manage, it's something that you can treat, and if you're suffering with pain, we can get that better for you as well. So if you're suffering with arthritis, or you know anyone who's suffering with arthritis in their knees, more than happy to see you in the clinic and we'll get you back on the straight and narrow.